Hello, I'm Dr. Derek Jones from Los Angeles. Today I'm going to demonstrate volumizing of the midface with particular emphasis on safe injections in the medial cheek. We're going to start with an aesthetic analysis of our beautiful model here. She has had on-label Botox before to both the glabella and the crow's feet. She likes it. It's worn off at this point. Give me a big frown. So I will do some Botox through here. Relax there. Not only does Botox take away the frown muscle, it actually helps to elevate the eyebrow. And we'll also do some on-label Botox to the crow's feet, which he has had before. Give me a big smile. To this area right here, we will relax orbicularis oculi so that when she smiles, those lines do not radiate as much. Let's look at her volumetric needs of the midface. She does have some volume loss here of the central cheek, which she would like to have corrected. And I'm going to show you my so-called harmonic reference lines, what I'm always drawing on patients when I'm trying to analyze midface volume deficit. So what I'd like to do is draw 3 lines that emanate from the mid-tragus. I draw one from the mid-tragus to the lateral canthus, another one from the mid-tragus to the mid-ala of the nose, and a third one from the lateral canthus to the corner of the mouth. So this delineates the upper mid-cheek into a lateral zone and a medial zone. In the beautiful, youthful female face, you will always see maximal volume right here. You open any Vogue or Cosmopolitan magazine, you will see the apex of the cheek in those young, beautiful women right in this area with maximal volume and light reflection. This area of her cheek is excellent. We could perhaps give her just a touch more volume right there. She doesn't need much. The medial cheek, however, could really use some volume. The medial cheek is considered a high-risk zone when it comes to vascular anatomy. She does need some volumizing right in this entire area here. But before we begin, we must understand the anatomy completely. So what I'm going to do is mark out the anatomy on the skin. We must first identify the facial artery and its branches. The facial artery originates deep in this area along the mandibular border. And a nice way to identify it is to identify where the anterior border of the masseter is. I like to have the patient clench down on their back teeth. Will you do that for me? Okay. And you can feel the anterior border of the masseter sitting quite nicely right there. Relax. And then if you feel quite carefully running your finger over the deep portion of the mandible, you can actually feel the arterial structure quite nicely. It's quite large right here. So what the facial artery does is it zigzags its way relatively deep up the cheek area here, and then right around the superior nasolabial fold, it becomes much more superficial as it branches off into the angular artery and begins to create connections that connect with the dorsal nasal artery, the supratrochlear artery, and the supraorbital artery. These all have connections to the ophthalmic circulation. This is a high-risk zone if you're working with a sharp instrument such as a needle for intravascular occlusion. So the medial cheek, anywhere from the mid-pupillary line down, is a cannula-only zone. For this reason, I'm going to be working in this area with a cannula. When injecting Voluma, in our office, we like to prep with Hibiclens, which is a very potent antimicrobial. And the reason for this is that Voluma is a long-standing filler, and we want to be cautious about introducing any bacteria with the implant that may create a biofilm and theoretically increase the risk of late appearing inflammatory reactions. So we like to get the area really, really clean. So we do a pass with Hibiclens, and then I come back after that and clean up with some alcohol. Now in doing that, you see that I have marked away my reference lines, but I'm going to reinforce them so that we always remember. So again, the area where we want to treat on her mid-face is roughly in this zone right here, okay? And her mid-cheek that needs volumizing. We must remember the extension of our facial artery here. As it comes up, it runs right in the area that we will be injecting. So remember, anywhere that is medial to this line, this mid-pupillary line, this is a cannula-only zone, so I will be demonstrating cannula technique. So at this point, what I'm going to do is I'm going to make a little entry port for my cannula, and I'm going to inject just a very small bleb of 1% lidocaine with epinephrine, and that was injected through a 32-gauge half-inch needle. And through that point, I am going to insert a 22-gauge needle and make a small entry port right there. And I will let that sit for a moment as I prepare my cannula. This is a 1 cc syringe of Voluma. This is a 27-gauge cannula. And what we do is through the cannula entry point, we slip the needle through, the cannula through rather, and I am in the subcutis at this point, so I will gradually run the cannula in this zone, and you can see where I am now as I lift up, and I'm going to very slowly inject in a subdermal plane very small amounts of Voluma. Now there's lidocaine in the product if she has any discomfort whatsoever, which is minimal. It will go away. So you can see with my lines over the skin that I am injecting in and around that higher risk angular artery, but I know that I am quite safe with the cannula. And putting just small amounts in here in no hurry. And at this point she will begin to feel a little bit of numbness in the central cheek. Not uncommon to have a little numbness of the lower eyelid. We always like to make patients aware of that so they know that that's completely normal. Great. And we injected about 2 to 3/10 of a cc. We want to be very careful not to overcorrect to keep her beautiful face looking harmonically beautiful, and we're doing a very nice job here. At this point I'm going to give her a little bit more inferiorly. I'm injecting in a retrograde fashion here. At this point I'm going to give her a little more in the medial cheek. Approaching the nasal sidewall, but not quite on it. And again, the most important thing I can tell you is that this is a cannula-only zone. Beautiful. Now that we have volumized her mid-cheek, I'm going to give her just a little bit in the zygomaticomalar area. She has a gorgeous lateral cheek here, but she's beginning to just get slight volume loss right up here at the apex, so I'm going to give her just a touch. And again, I like to inject on a periosteal plane here, small aliquot, and subtle is the rule on someone like this who we are just enhancing natural beauty and not doing major volume restoration. I'll give her one more little pop here. Smile for me for a moment. Great, and relax. And just a little bit of support right here. Great. And at this point, I will just hold a bit of pressure for about 30 seconds. We have just completed 1 cc of Voluma using a cannula to the medial cheek and using a periosteal depot technique to the zygomaticomalar area. And you can see this very nice, subtle, yet very real correction. And she's already thrilled. We've showed her in the mirror and she thinks it looks great. And as a professional model, she's going to be great to continue right along. I have now marked her left face out to match the markings on the right side. And I am again going to do a Hibiclens prep in this area. And then I will come back with a little bit of alcohol. At this point, I'm going to put a little anesthesia in at the cannula entry point. So the entry point should probably be right around here, right in the area of that little lentigo sitting there, little tiny stick. And just a tiny little bleb through a 32 gauge half inch of 1% Lido with epinephrine. And through this bleb, we make a little entry port with a 22 gauge needle. And I'll let that sit there for just a moment. And then we retract the needle, and using this 27 gauge cannula through that entry point, we insert our cannula into the subcutaneous plane. Again, remembering that we are in the vicinity of the angular artery and its tributaries, we are using a cannula for safety. Now I am going to inject using a very slow linear retrograde technique. Look how utterly slowly that I'm injecting the product. Part of good injection technique and getting a beautiful outcome with very few to no signs that we were here is going very slowly. And again, we know that the cannula is helping to protect both microvessels and macrovessels in this plane, so risk of bruising, purpura is lower. Beautiful. So at this point I'm going to break in this massage a bit. I've done about half a cc there, and she's already looking great. At this point, I will often step back a little bit and look at the patient from a frontal view and see where I may need more material. And I think that compared to the correction that we have on the other side of the face, that she is still somewhat deficient right here in this aspect of the medial cheek. So knowing that I put about 0.7 to 0.8 in this medial cheek, I'm going to need to match the volume. So I'm going to go back in through my cannula entry point. And right in this area, I often lift up on the needle to see exactly, or the cannula rather, to see exactly where my tip is. And I'm very slowly keeping the cannula in constant motion, going to deposit a bit more in this area. Notice that I'm not treating the tear trough proper. However, we know that by volumizing the mid-face in this area that we get improvement of the tear trough, and we prove that quite nicely in the Voluma pivotal trial, which is published in the Journal of Dermatologic Surgery. We now have completed injection of about 0.8 cc's of Voluma into the medial cheek, and just as I did on the right cheek, I'm going to go into this area. Again, when we're working in the zygomaticomalar area, this is not as high risk in terms of blood vessels and intravascular injection. Generally, we like to inject right down on periosteum. That's how we get the biggest bang out of our filler. Okay, a little tiny stick. And again, she doesn't need much here. We're bringing her up just a little bit. And this volume through here actually helps give a little support underneath the crow's feet as well, which is one added benefit. A little bit of tenderness there, my dear, sorry. But that will numb up very quickly there. No bleeding, no bruising. One, a little bit more right here. And we are now complete. So here we are immediately after 1 cc of Voluma to each cheek, using most of the volume in the medial cheek and just a little bit at the lateral cheek. And you can see that immediately after treatment, she looks great. She's happy with some makeup. She can go right back into her day.